It is 8:12. Welcome back. Time for our Fox 4 House Call with Dr. Andy. And today we are talking about house call docs like yourself, because it's pretty rare in today's age to find a doctor who I can call and say, come to my house, I'm sick, I'm not coming to you.
You're right. It's becoming more common in some metropolitan areas like Miami and Tampa, but I believe I'm the only one in this area of the state that does just house calls.
So why house calls? Why did you decide to do that?
Well, a lot of reasons. The biggest one is time. There's more time with the patient, more time dealing with all of their issues, more time with family member, with your own family afterwards. So.
And it probably gets to be more personable, because it feels like sometimes you get shuffled into a doctor's office, you see him for 5 seconds, and then it's out the door.
In fact, I named my business Personalized Healthcare, but they're personal or personalized. You'll see in a lot of names of practices that do this. And there are a growing number of these practices that may offer house calls as well in Naples and in Fort Myers.
So what's unique about it? Can you provide anything my normal doctor can, or do you have some limitations?
I can probably provide more than what I used to provide in the office, just because there were a lot of things that we used to send to the emergency room that now I can take care of, or tell people to wait for me and I'll meet them at home, just because a lot of those emergencies were actually urgent issues that didn't belong in the emergency room. While in a busy office, there's just no time to deal with those things. A few things we can't do in the house, as you can imagine: gynecology exams, breast exams for women. Those are things that I still send to specialists who are friends of mine.
Right. You probably don't have the X-ray equipment in the back of your vehicle.
No. But you know, we have wonderful radiology facilities in this area that people can get into the same day or next day as well. So.
Now, what do you carry with you? Is it the classic black doctor's bag that we're used to in the old movies?
It is a black doctor's bag. However, it's actually a little bit bigger than it used to be, because I do carry equipment, and some of the people that do it, I do also carry the same equipment for biopsying small skin lesions if somebody is, for example, homebound and can't get out to a dermatologist, or also equipment for sewing up skin cuts in kids or in adults who may have been using a knife in the kitchen.
Simple stitches or something.
Exactly.
What about defibrillators? We see them like in the airports and the malls. Do you have that capability?
I carry an EKG machine, but I don't carry a defibrillator, and the reason I don't is because I'm not an emergency responder. If someone's having a heart attack, they really can't afford to wait for me to get there. It might take me an hour or two to get over to somebody in our county, being as big as it is. So I don't carry a defibrillator, but of course we have to be trained in CPR and ACLS and everything else.
But you are a doctor on call. They all have your cell number.
That's right, 24/7. You're never off call.
For more on personalized healthcare, you can always get in touch with Dr. Andy by giving him a call, 694-6246, or shoot him an email. He'll answer any of those. Dr. AOL at phc-md.com. Dr. Andy, thank you so much, and he'll have another health topic for us next week at this time.
See you next week.
Stick with us, Jeff.